Today we'll be talking about oseltamivir phosphate, which is better known as Tamiflu. Tamiflu's classifications include therapeutic, which is antiviral, and pharmacologic, which is a neuraminidase inhibitor. So you're probably wondering, what is Tamiflu? Tamiflu is an oral antiviral medication that is used to lessen and treat the symptoms of the influenza virus. It can be used in adults and children over the age of 2 weeks. It can also be used to prevent the influenza virus in adults and children over a year old. Tamiflu works by inhibiting the enzyme neuraminidase. The enzyme neuraminidase works by allowing the influenza cells into normal host cells, where they'll aggregate and release into other cells. What Tamiflu does is it clips the enzyme off of the host cell so the virus cannot spread. The pharmacokinetics of Tamiflu are quite simple, considering that Tamiflu is only available in an oral pill. It is absorbed by the GI tract, the distribution patterns are unknown, and the protein binding is only 42%. Metabolism occurs in the liver, in which it is turned into oseltamivir carboxylate. The half-life is usually an average of 6 to 10 hours. The excretion occurs solely in the kidneys, in which over 99% happen. The contraindications of Tamiflu include a hypersensitivity to oseltamivir phosphate. Children with symptoms under the age of 2 weeks, uh, the negatives outweigh the benefits. Also, children under the age of 1 trying to prevent the flu are at a risk as well. With this being said, renal function is the number one contraindication, considering that over 99% of the medication is excreted through the kidneys. Those dosages for symptoms and prevention are both the same. Um, as you can see, adults and children that are 13 years or older are prescribed 75 milligrams twice daily by mouth for 5 days. However, children under the age of 13, the dosage is solely based upon their weight. As you can see, as the weight goes down in a child, so does the dosage. Dosages for symptoms and prevention with patients with renal impairment. As you can see, it depends on the adult creatine clearance. As the creatine clearance begins to drop, so does the dosage. However, with a creatine clearance of less than 10 millimeters per minute and not on dialysis, it is not recommended with patients. Some of the adverse effects of Tamiflu can potentially cause seizures in individuals who has never had a seizure in their life. It can also affect cognition by causing delirium, agitations, hallucinations, nightmares, vertigo, confusion, and insomnia. It can also cause respiratory distress and nausea and vomiting. The only main drug-drug interactions that Tamiflu has is with the influenza vaccine. It could lower the therapeutic effect of it. Individuals should take Tamiflu 2 days prior or 2 weeks after receiving the vaccine. With patient teaching, nurses should always advise to take Tamiflu as soon as symptoms occur and complete the regimen course, even if they are feeling better. Also, if a patient misses a dose and if they remember, they should not take it within 2 hours of the next dose. Also, oseltamivir is not a substitute for the flu vaccine. Patients should be taught this, and patients should be taught to immediately report any cognitive difficulties while taking Tamiflu, and they should be taught to consult a healthcare provider before taking any other medication with Tamiflu. A popular theory through the medical world was that Tamiflu potentially caused suicidal ideation in patients under the age of 18. Using 21,000 suicide related events, they found that 251 of them took Tamiflu and that there was no correlation, so that was debunked. Reports during the swine flu pandemic in 2009 showed that many individuals were prescribed Tamiflu. With patients that had symptoms 4 days or less, only 8% died from the disease, while patients that had the symptoms for 4 days or more, 69% of them passed. In conclusion, Tamiflu is a drug that could save an individual's life. A healthcare provider must weigh out the benefits versus the negative when giving Tamiflu. An individual also must be willing to adhere to a medication regimen for the sake of themselves and the people around them.